Hello everyone and welcome to Star Health Insurance YouTube channel. I'm Dr. Manjunath Pandit, Interventional Cardiologist. Today I'm here to educate you on ways to avoid heart attack. Before we learn the ways to avoid heart attack, let's understand what is heart attack. Heart attack is a common word for myocardial infarction. Heart is an organ entirely made up of cardiac muscle and the layers and valves. Like any organ or a muscle which needs nutrients and oxygen for its survival. Now, heart is supplied by primarily three arteries. There are two arteries on the left side and there is one artery on the right side. These arteries are responsible to carry oxygenated blood and nutrients to these muscles which are continuously and tirelessly working throughout day and night. Now, what happens in a heart attack? Because of the risk factors that I'll be discussing ahead, there is a process called as an atherosclerosis. Atherosclerosis, a process of deposition of cholesterol and lipids on the inside of the walls of your arteries, is a process which develops over age and it is continuous. So there are several risk factors which I'll be discussing ahead which may lead to an accelerated process of this atherosclerosis. So this atherosclerosis builds up plaque, cholesterol plaques, which further progresses and may lead to a heart attack or a myocardial infarction. Now, the deposition of the cholesterol when studied primarily consisted of cholesterol particles which were predominantly a lethally dangerous cholesterol, that is an LDL cholesterol. So when an individual consumes a fat-rich food, that food is processed in the liver and is converted into cholesterol. Now, not all the cholesterol are bad. So when we do a lipid profile, we get 5 parameters ranging from LDL, VLDL, HDL, chylomicrons and triacylglycerols. I want to focus on two important parameters in this lipid profile. One is HDL, which is very important and is also called as a good cholesterol. We need to maintain an HDL levels of more than 40. And then comes LDL. So LDL stands for low density lipoprotein, or you might also remember it as a lethally dangerous lipoprotein. So the LDL is the one which is primarily responsible for atherosclerosis or building up a cholesterol plaque inside the arteries of your heart. Then LDL level of more than 100 is dangerous. Some individuals may even have an LDL level of more than 200. In these individuals, an incidence of younger heart attack is more common. So coming to the risk factors which lead to a development of atherosclerosis and a heart attack can be largely divided into risk factors on which we don't have any control. They are called as non-modifiable risk factors. And then comes a modifiable risk factors. So non-modifiable risk factors, the first and foremost important is the age. So age is a continuous number and we don't have any control over it. And we all know with advanced age, there is an increased risk of heart attack. Then comes sex. So sex is not changeable. So individuals who are males are at a higher risk of heart attacks when compared to females. Primarily because of testosterone. Testosterone is being studied as an atherogenic hormone. And this reason is why people who abuse steroids are at a higher risk of myocardial infarction or sudden cardiac death because of heart attack. The next non-modifiable risk factor is race. Southeast Asians and Indians are at a higher risk of developing heart disease and at an earlier age when compared to Caucasians. Then comes genetics. As I told you, the levels of LDL or HDL vary from families to families, depending upon the enzymatic activity. So few families or few individuals are at a higher risk of developing heart disease and at an earlier age when compared to others. When coming to modifiable risk factors that we all know of, range from smoking, alcohol, obesity, sedentary lifestyle, diabetes, and hypertension. Now moving ahead, I want to educate you all on how to differentiate a chest pain that is originating from a heart attack to that of a chest pain from non-cardiac reasons. This is quite important to know and not to worry. Chest pain arising out of a heart attack is called as a typical chest pain. Now, what are the characteristics of this typical chest pain? Pain should be located either on the anterior chest wall or on the posterior chest wall. It should be diffuse and it may radiate even to the neck or on the inner side of the arm. Pain should at least last more than 20 minutes. Typical chest pain may often be associated with sweating or perspiration. And also, this typical chest pain may increase on doing any physical exertion or may decrease while taking rest or a sublingual nitrate. Now, what to do if you develop a typical chest pain? First and foremost is to keep calm and breathe. Any anxiety or any apprehension may only worsen your situation. Inform the family and get a nearest medical help. It's advisable to get an electrocardiogram done, which will most likely diagnose if you're having a heart attack or not. If available, a sublingual nitrate is advisable to be taken. But It is also important to keep a watch on your blood pressure since few individuals may suffer hypotension by using sublingual nitrate. On admission or on presentation to hospital, your physician or cardiologist may diagnose you by doing an electrocardiogram or a 2D echocardiogram, may also subject you to a coronary angiogram. A coronary angiogram will definitely prove a coronary artery disease or will detect the number of blocks that you have. And the therapy will be provided in the form of an angioplasty or a coronary artery bypass grafting. Now, how to know if the process of cholesterol deposition or atherosclerosis has begun? If you go to your cardiologist may perform two tests. One is an anatomical test to study the structure of your heart, which is called as an echocardiogram. And then there is a functional test, which is called as a treadmill test. On subjecting you to both these tests, it would be confident enough to say whether you have any significant deposition of cholesterol inside your arteries. Some may also need a further evaluation in form of a CT coronary angiogram or a conventional coronary angiogram. Now moving into the final segment where we have curated 5 mantras to avoid heart attack. Number 1 is avoiding all forms of smoking and alcohol. Number 2 is maintaining a basal metabolic index, that is BMI, between 18.5 to 24.9. Exercising daily for at least 20 to 30 minutes and should last at least 150 minutes a week. And maintaining your LDL levels in check. Maintaining an LDL level below 100 is advisable for general population and a level less than 70 is advisable for someone who is at a high risk. And finally, getting an annual health checkup to screen for any imminent heart diseases. So that's all for this video. If you have liked this video, hit the like button, comment with your queries below, and don't forget to subscribe to Star Health Insurance YouTube channel for more valuable insights.